I've seen very sick patients. I've taken care of old people, young people, couples with COVID. I've taken care of people who have died and people who have lived, and it's humbling.
This experience has been very humbling for me. It's tested me in so many different ways, mentally, physically, and emotionally. When I came into New York City and started working at Elmhurst Hospital, one of the hardest hit hospitals in New York City, the whole atmosphere was definitely something I've never experienced before.
It's the first time in my life as a nurse that I've ever been scared to go to work.
Each day walking into work not knowing what was going to happen.
In the United States, we have had over 110,000 people suffocate from this disease. And then another cop killed another person of color, George Floyd. That's messed up. He couldn't breathe either. And yeah, all of this was preventable. All of it. Almost to the person was preventable, and we didn't prevent it. We didn't care enough. We didn't step up enough. We didn't do the right things.
Typically, people don't really get involved in public health with our outbreak response. You know, when we have an E. coli outbreak due to spinach, we don't have elected officials telling us what to do.
My experiences of working through this pandemic can be underlined by two words: health and equity.
I have experience in global health, and I'm used to making something out of nothing in places with limited resources. I just have never had to do that in my home state.
I am honored to work on the front lines of this pandemic. I am honored to work on the educational component, the community outreach, and everything else I'm involved in, but this is really, really hard.
The work that I do with regard to the pandemic is that it's less frontline, it's more educational in terms of public health. And for that, it's the frontline of providing a voice to Native communities and to Native health issues that are occurring within our communities that are very alarming.
We are the primary care for the homeless in Dallas, Texas. So when pandemics like this happen, like the COVID, we're pulled and we're deployed to do other things. So that's exactly what happened to us.
Kids need tested for COVID-19, so we've catered to kids so that they're not scared to be tested.
I've been an OBGYN providing abortion care for the last 7 years. During the COVID-19 pandemic, I've continued to provide comprehensive reproductive health care, including abortion. So my frontline battles were less against the virus and more against the politicians who took advantage of the pandemic to restrict a woman's right to choose. But when the governors of states like Texas and Oklahoma used the pandemic as a way to further their political agendas at the expense of the safety of their constituents by nearly eliminating access to abortion, the volume of patients needing to travel to the states where I work skyrocketed. One day in Kansas, I saw over 20 patients who had traveled from Texas.
I was mobilized as a soldier in an Army Urban Augmentation Medical Task Force, part of the Department of Defense National Response to the COVID-19 pandemic. Specifically, I was at the Boston Hope Field Hospital.
With the pandemic escalating within the state of New Mexico, we basically decided to pull our skills together and using 3D printing create these masks that I have right here on my neck in order to help provide some personal protective equipment for our community and our first responders across the state.
I went to work part-time in 2019 as sort of a slow slide to retirement. But who knew COVID was coming? As soon as COVID hit in March of 2020, I asked to come back.
I've seen patients my age, my kids' age. That's extremely disheartening to see when, people like that, when they're, going through so much pain and they're sick. And the worst thing is when you see patient dying without a family member by their bedside. Very traumatic. It's something I'll take to my grave.
The scariest part is not having enough PPE. You don't know if you're going to take this virus home to your family. You don't know if you're going to spread it to other patients that didn't come in to be treated for COVID. You don't know if you're going to spread it to your coworkers.
Handling the number of deaths was difficult both physically and emotionally. Physically working in full PPE for long hours added to the physical exertion.
Initially, there was a lot of fear. There was a lot of what ifs and what the best course of treatment was for patients. And would we have enough open ICU beds? Did we have enough PPE to keep us safe? But as the days went by, we just put one foot in front of the other and took care of the patients that came in as best we could, like we always have.
I think some of our guiding principles on incident command has really been around sticking to the science of the virus.
My best advice for people in the state right now, and honestly it's for the people in the country, is to just be brave. Be brave enough to resist the pressures of going back to life as usual before coronavirus.
It's a totally different virus than anything that we've seen before, so listen to what they say. Wear your mask wherever you go.
The current COVID situation right now is manageable as long as we can follow those recommendations by the experts.
We truly in this moment need to lean in and truly think of each other as family and community.
You know, no matter your circumstance right now, everyone is facing some really tough times.
My best advice for people in my state is to take this seriously. This is not just the flu.
We are still very much in this. There's a long way to go.
We don't know if we're going to get another surge in the fall, but we should assume we are, so please keep being safe and protect your loved ones.
COVID-19 is a disease of the people, and it means that we need to think about protecting others.
Stay home and stay strong. I know it's hard, but you can do it.
My name is Dr. Alia Jones.
I'm Amna. My name is Annie Belcourt.
Dr. Ebony Jade Hilton.
I'm an emergency medicine physician.
I'm an obstetrician gynecologist.
I've been a flight nurse for 6 months.
And I'm a badass woman.
I am a badass woman.
I'm Dr. Leanne Webb, and I'm a badass woman.
I'm a badass woman.
And we're badass women.
I'm a badass.
Badass.
I am a badass woman.
I'm a badass woman.
I'm a badass woman.